Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for chapter 19, which deals with injury, poisoning and certain other consequences of external causes. Here we will be discussing the part 2. This is a continuation of part 1. In the current session, we will be discussing the coding of injuries, coding of burns and corrosions, adult and child abuse, neglect and other maltreatment. Whereas adverse effects, poisoning, underdosing and toxic effects, it is available as different video which you can find in the playlist. So these three topics will be covered in this session. Coming to coding of injuries, that is into superficial injuries, guidelines regarding superficial injuries, guidelines regarding the primary injury with damage to nerves or blood vessels, and laterogenic injuries. Coming to coding of injuries, when coding injuries, assign separate codes for each injury unless a combination code is provided, in which case combination code is assigned. Codes from the category T07, unspecified multiple injuries, should not be assigned in inpatient settings unless information for more specific code is not available. Coming to traumatic injury codes, which come under the category S00 to T14.9, are not to be used for normal healing surgical wounds. Traumatic injury codes should not be used for normal healing surgical wounds or to identify complications of surgical wounds. They are assigned with different codes. And the code for the most serious injury is determined by the provider, and focus of treatment is sequenced first. PDX will be the most severe injury as determined by provider, and the focus of treatment would be sequenced first. Coming to superficial injuries. Superficial injuries such as abrasions or contusions are not coded. This is important. Are not coded when associated with more severe injuries at the same site. For example, there is a knee abrasion and knee fracture. So you will code fracture code only. Abrasion code is not necessary. Coming to primary injury with damage to nerves or blood vessels. When a primary injury results in minor damage to peripheral nerves or blood vessels, the primary injury is sequenced first with additional codes for injuries to nerves and spinal cord, which come under the category S04, and or injury to blood vessels, which come under the category S15. Whenever a primary injury is causing damage to nerves or blood vessels, PDX will be the primary injury, followed by, depending upon the damage, either codes for nerves, which come under the category S04, or codes for injury to blood vessels, which come under the category 815, should be coded. PDX would be the primary injury only. When the primary injury is to blood vessels or nerves, then that injury should be sequenced first. Next, finally coming to laterogenic injuries. These injuries are not regular injuries because they occur during or as a result of medical intervention. The injuries which occur during a procedure are called as laterogenic injuries, and you need to assign appropriate codes. Injury codes from chapter 15 should not be assigned to injuries that occur during or as a result of medical intervention. Assign the appropriate complication codes. Normal traumatic injury code should not be assigned for laterogenic injuries. That is the basic guideline. Now let us see an example. My surgeon was called to the OR by an OB gynecologist who accidentally lacerated the bowel during an open gynecological procedure. Here, the procedure is gynecological procedure, but the gynecologist accidentally lacerated the bowel. So she repaired the bowel with same sutures. So here what is the ICD, appropriate ICD? There is an injury, laceration to bowel, but that has occurred during a procedure. So the appropriate code would be K91.72, accidental puncture and laceration of a digestive system organ or structure during other procedure. Here you are not using S codes. You are using the appropriate complication code K91.72, which is nothing but accidental puncture and laceration of the digestive system, organ or structure during the other procedure. Now coming to next example, a patient has a 2 centimeter laceration of the left heel with a foreign body and has a scar present. So scar can be considered as sequelae. So first condition should be coded, then the appropriate injury code with S. So first L90.5 scar condition and fibrosis of skin, followed by S91.322S. Seventh character S indicates sequela. Laceration with foreign body, left foot sequela. Now coming to coding of burns and corrosions. It is again subcategorized into guidelines regarding the sequencing of burns and related condition codes, burns of the same anatomical site, non-healing burns, infected burn, and assign separate codes for each burn site. Additionally, burns and corrosions classified according to the extent of body surface area involved, encounter for treatment of sequela of burns, sequela with late effect code and current burn, and use of an external cause code with burns and corrosions. Now coming to coding of burns and corrosions. ICD 10 makes a distinction between burns and corrosions. Burn codes are for thermal burns, except sunburns that come from a heat source such as fire or hot appliance. General burns are for thermal burns except the sunburns. These thermal burns, they come from heat source such as fire or hot appliance. Next, burn codes are also for burns resulting from electricity and radiation. They can be also for burns resulting from electricity and radiation. And corrosions are burns due to chemicals. This is important. What are corrosions? Corrosions are burns due to chemicals, and the guidelines are same for burns and corrosions. Coming to current burns, which come under the category T20 to T25, are classified by depth, extent, and by agent. They are classified by depth, extent, and by agent. And burns are classified by depth as first degree, which causes erythema, second degree, which causes blistering, and third degree, which causes full thickness involvement. And the burns of eyes and internal organs, which come under the category T26 to T28, are classified by site, not by degree. This is also important point. Burns of eyes and other internal organs are classified by site, anatomical site, not by the degree. So based upon the degree, burns are classified into three types: first degree, second degree, and third degree. First degree is associated with erythema, second degree burn is associated with blistering, third degree burn is associated with full thickness involvement. And whenever the physician documents either erythema, blistering, or full thickness involvement, you need to code the respective degree of burn. Now coming to sequencing of burns and related condition codes. Sequence first the code that reflects the highest degree of burn when more than one burn is present. Highest degree. For example, one burn is of first degree and the other burn is of second degree. Then the PDX would be the second degree burn if multiple burns are present. And when the reason for admission or encounter is for the treatment of external multiple burns, sequence first the code that reflects the burn of highest degree that we have discussed. Highest degree should be coded as PDX. Second point, when a patient has both internal and external burns, the circumstance of admission govern the selection of the principal diagnosis or first listed diagnosis. That is the reason for encounter. If the patient is presenting for internal burns as reason for admission, then you need to code internal burns as PDX. If the patient is presenting for treatment of external burns, then you need to code external burns as PDX. It depends upon it is governed by the circumstance of admission. Third point is when a patient is admitted for burn injuries and other related conditions, such as smoke inhalation and or respiratory failure. Here also the circumstance of admission governs the selection of PDX. Patient is admitted for burn injuries and other related condition. Based upon the treatment, If the patient is having respiratory failure and immediately treatment is governed to reduce respiratory failure, then respiratory failure will be the PDX. Or else if the patient is treated for the burns first, then burn injuries will be the PDX. In whichever cases, reason for encounter will be the PDX. And highest degree burn should be coded first. Coming to burns of the same anatomical site. Classify burns of the same anatomical site and on same site but of different degree to the subcategory, identifying the highest degree recorded in the diagnosis. In simple terms, if there are two burns, first degree burn and second degree burn on right elbow, then you can code only second degree burn. First degree burn is not necessary. The burn of highest degree will be coded if the burns are on the same anatomical site. But in second case, if the patient is having first degree burn on right elbow and second degree burn on left elbow, here the laterality is different. You need to code both burns. Only when burns of the same anatomical site, if they are present on different degrees, highest degree is recorded in the diagnosis. Next point, non-healing burns. Non-healing burns are coded as acute burns. This is also important. Non-healing burns are coded as acute burns and necrosis of burned skin should be coded as a non-healed burn. Whenever the burn has necrosis, burned skin of necrosis should be coded as non-healed burn and non-healed burns are coded as acute burns. Next is infected burns. For any documented infected burn site, use the additional code for infection. If there is any infection associated with the burn, first you need to code burn code and then additional code for infection. Next guideline, assign separate codes for each burn site. When coding burns, assign separate codes for each burn site. Category T30. Burn and corrosion. Body region unspecified is extremely vague and should be rarely used. Category T30. Burn and corrosion. Body region unspecified. It is extremely vague and it should be rarely used. And the codes for burns of multiple sites should only be assigned when the medical record documentation does not specify individual sites. Whenever individual sites are not documented, in such cases only burns for multiple sites should be assigned. Next, coming to next guideline, burns and corrosions classified according to the extent of body surface area. Assign codes from category T30, burns classified according to extent of body surface area, or T32, corrosions classified according to the extent of body surface area for acute burns or corrosions, when the site of burn or corrosion is not specified or when there is need for additional data. In some cases, the provider documents the extent of body surface involved. In such case, you can go for the category T31 or 32, burns and corrosions according to the extent of body surface area. So it is advisable, one more point is, it is advisable to use the category T31 as additional coding when needed to provide data for the evaluating burn mortality, such as that needed by burn units. And it is also advisable to use category T31 as an additional code for reporting purpose when there is a mention of third degree burn involving 20% or more of the body surface area. T31 category can also be used as additional codes in two cases. The first case is for evaluating burn mortality such as that needed by burn units, or whenever there is a mention of third degree burn involving 20% or more of the body surface area. In such case also you can use additionally codes from T31 category. And the codes from category T31 and 32 should not be used for sequelae of burns or corrosions. This is also important. They should not be used for sequelae of burns or corrosions. And categories T31 and 32 are based on classic rules of nines. Rule of nines. in estimating the body surface area. These percentages are important. T31 and 32 are based on classic rule of nines. Head and neck regions are assigned 9%. Both head and neck together they are assigned 9%. And each arm is assigned 9%. Each leg is assigned 18%. The anterior trunk is assigned 18%. Posterior trunk is assigned 18% and genitalia account for 1%. These are the rule of nines based upon the body surface involved. So depending upon the anatomical location, you can assign the percentage. And the providers may change these percentage assignments where necessary to accommodate infants and children who have. These can change for infants and children who have appropriately larger heads than adults and patients who have large buttocks, thighs or abdomen that involve burns. These percentages may be varied by providers, especially to accommodate the infants and children who have proportionately large heads than adults or the patients who have large buttocks, thighs or abdomen that involve the burns. Coming to next guideline, encounters for treatment of sequelae of burns. For the encounter of treatment of late effects of burns or corrosions, such as scars or joint contractures, they should be coded with a burn or corrosion code with 7th character S. Complications can be coded along with the burn codes with 7th character S. And sequelae with late effect code and current burn. Second scenario, sequelae with the late effect code and current burn. When appropriate, both a code for current burn or corrosion with 7th character A or D and a burn or corrosion code with 7th character S may be assigned on the same record when both current burn and sequelae of an old burn exist. This is important. We can code both current burn and sequelae of old burn. When appropriate, both a code for current burn or corrosion with 7th character, it can be either A or D, and a burn or corrosion code with 7th character S may be assigned on the same record when both a current burn and sequelae of an old burn exist. Next point is burns and corrosions do not heal at the same rate, and a current healing wound may still exist with sequelae of a healed burn or corrosion. They don't heal at same rate, and there can be coexistence of current healing wound with a sequelae of a healed burn or corrosion. There is a possibility, and whenever they are appropriate, you can use both codes. Next guideline, use of external cause code with burns and corrosions. An external cause code should be used with burns and corrosions to identify the source and intent of burn as well as the place where it has occurred. So you can employ external cause codes with burns and corrosions. Let us see an example. A patient is seen for initial assessment of the right ankle for burn injury resulting from contact with a space heater, and on evaluation he is found to have first degree burn, and in this case the appropriate diagnosis code would be first the burn code, which is T25.111A, burn of first degree of right ankle, initial encounter A, followed by, here we are using an external cause code X16.XXXA, contact with hot heating appliance, radiators and pipes, initial encounter. So you can use external cause codes along with the burn injury codes. One more example. Keloid scar, left forearm resulting from second degree burns. Injury occurred 1 year ago. So first the condition is coded. Scar is coded L91.0, hypertrophic scar or keloid scar, followed by T22.222S, burn of second degree of left elbow, sequela. 7th character S indicates sequela. So we have completed the coding for burns and corrosions. Now coming to adult and child abuse, neglect and other maltreatment. Sequence first the appropriate code from category P74. Adult and child abuse, neglect and other maltreatment confirmed. T74 category confirms the abuse. The next is T76 category. It is adult and child abuse, neglect and other maltreatment suspected for abuse. Suspected is suspected comes under T76 series. Confirmed cases come under T74. So based upon the provided documentation, so you need to quote the appropriate categories. When it is confirmed, you need to assign the codes from T74. When it is suspected, you need to assign the codes from T76. If the documentation in the medical record states abuse or neglect, it is coded as confirmed. And it is coded as suspected if the documentation, if it is documented as suspected. If the documentation in the medical record states abuse or neglect, it is coded as confirmed. If the documentation, if it is documented as suspected, then you need to code suspected category. And for cases of confirmed abuse or neglect, this is also important. For cases of confirmed abuse or neglect, an external cause code from the category assault section X92 to Y09 should be added to identify the cause of any physical injuries. In case of confirmed cases, if there are any physical injuries, then you can assign the codes from assault section which come under the category X92 to Y09. And additionally, a perpetrator code which can be taken from category Y07 should be added when the perpetrator of the abuse is known. In case of confirmed cases only. That is, along with T74 series only, you can use X92 to Y09 if there are any physical injuries, and additionally you can use a code from Y07, that is the perpetrator code, whenever the perpetrator of the abuse is known. Now cases when T76 should not be coded. When should we not code the confirmed cases? The first one is if a suspected case of abuse, neglect or mistreatment is ruled out during an encounter, code. Suspected case is ruled out. In that case, you should not code T76 series. Whenever the suspected case of abuse, neglect or mistreatment is ruled out during an encounter, there are two scenarios here. You can code Z04.71. Encounter for examination and observation following alleged physical abuse ruled out. Adult abuse, physical adult abuse ruled out, or Z04.72. Encounter for examination and observation following alleged child physical abuse ruled out. Whenever adult physical abuse is ruled out, you need to assign Z04.71, and whenever child physical abuse is ruled out, that is, it is not confirmed, you are suspected, but after examination you have ruled out, then you can use the code Z04.72. And next case, if the suspected case of alleged rape or sexual abuse is ruled out during an encounter, then you can code Z04.41. Whenever an alleged adult rape is ruled out, or Z04.42 whenever the child rape is ruled out. The suspected child rape is ruled out, you can code Z04.42. For adult, it is Z04.41. Third case, if the suspected case of forced sexual exploitation or forced labor exploitation, sexual exploitation or labor exploitation is ruled out during an encounter. The appropriate codes would be Z04.81. For encounter for examination and observation of victim following forced sexual exploitation ruled out, or Z04.82. Encounter for examination and observation of victim following forced labor exploitation should be ruled out. should be used whenever it is ruled out. So these are the cases where confirmed cases of abuse should not be coded. Cases where P76 should not be coded are listed out here. Now let us see an example. During an examination of a 10-year-old male patient, the pediatrician discovers extensive bruising around the child's buttocks and left thigh. And the pediatrician initially suspects that child's father has physically abused him. However, further examination and questioning of patient reveals that the boy has been involved in a particularly rough game of tackle football with his friends. So here the physician suspected, but it was ruled out. So the appropriate codes would be, and there is a physical injury. So injury codes are sufficient. S30.0XXA. Contusion of lower back and pelvis initial encounter. S70.12XA. Contusion of left thigh initial encounter, and following external cause code Y93.61. Activity American tackle football. Here you need not code any codes from category T74 because though it is suspected, whenever there is physical injury, the suspected abuse is ruled out and there is a physical injury, you need to code only physical injury codes. You need not code observation codes also because there is a physical injury. Now coming to next example. A 16-year-old female patient reports to her pediatrician and confides that she has been forcibly raped by her boyfriend and that this is the first time she has told anyone about the incident. And the pediatrician examines the patient and confirms the patient's allegations. So the appropriate codes are, here the abuse is confirmed. T74.22XA, child sexual abuse confirmed initial encounter because the patient is only 16 years old. Followed by Y07.03, male partner, perpetrator of maltreatment and neglect. Next example. During an initial visit, a married woman admits to physical abuse by her husband, but this is not confirmed with any physical injuries. So the appropriate code would be T76.11XA, adult physical abuse suspected initial encounter. By this we complete the codes regarding the abuse and neglect and maltreatment. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.